All right. Hello, everyone. Welcome to this special Macdonald-Laurier Institute webinar. My name is Dr. Sean Watley. I work as a physician. I'm a past president of the Ontario Medical Association. I'm an author. But for today, I'm senior fellow of the Macdonald-Laurier Institute. And I'd like to briefly introduce the Institute, although I know many of you watching online today have already attended our events live in person in Ottawa and elsewhere. In 2020, the Macdonald-Laurier Institute, or MLI, is celebrating its 10th anniversary, and the Institute has grown steadily in reputation and influence over the past decade. It is the leading independent federal public policy institute in Ottawa, and it is at times like this that we see the importance of creating such a great platform for the best public policy ideas. The COVID-19 crisis really has touched on all aspects of the Institute's work, from Indigenous affairs to international relations, defense and security, healthcare, and economic and fiscal policy. And this event is the continuation of a large body of work that the Institute and its fellows have produced in just the past few weeks. As Canada's policymakers continue to struggle to contain COVID-19, they must also prepare to move to a more sustainable long-term solution to this pandemic. In doing so, they will need to seek the best advice from around the world on measures for testing, tracing contacts, quarantine, and caring for all the patients already infected by COVID-19, and at the same time, preserving the healthcare system and starting to reopen our economy. So this morning, MLI has brought together perspectives from leading medical experts and international affairs experts to comment on the situation in Taiwan, South Korea, Denmark, and elsewhere so that we can all learn from each other and seek the best ways forward. But before we turn to our panelists, we have the great fortune of receiving a short video address by Taiwan's remarkable Digital Minister Audrey Tang, explaining some of the keys to Taiwan's success so far in dealing with the COVID-19 pandemic. And I'd like to play that video for you right now.
Hello, I'm Audrey Tang. I'm really happy to be here to share with you some thoughts around how Taiwan countered the coronavirus using the power of digital social innovation. Social innovation, that is to say, people who participate from all walks of life in order to publicly benefit the society, is the cornerstone of the Taiwan's collective intelligence response system, and it's really fast. Whereas many jurisdictions began countering coronavirus only this year, Taiwan started last year. Last December, when Dr. Li Wenliang, the PRC whistleblower, posted that there are new SARS cases, he gets inquiries and eventually punishments from his local police institutions. But at the same time, the Taiwan equivalent of Reddit, the PTT board, has somebody with the name Normal Repipe reposting Dr. Li Wenliang's whistleblowing. But instead of facing discipline, the head of the CDC immediately noticed this post and issued an order that says that all passengers flying from Wuhan to Taiwan need to start health inspections the very next day, the first day of 2020. And so this says two things. First, that the civil society trusts the government enough to talk about possible new SARS outbreaks in a public forum, and that the government trusts the citizens enough to take it seriously and treat it as if SARS has happened again, something we've always been preparing since 2003. And because of this open civil society, according to the Civicus Monitor, Taiwan is the most open society in the whole of Asia. We enjoy the same freedom of speech, the same freedom of assembly, of the press, and so on as other liberal democratic countries, but with the emphasis on keeping an open mind to new novel ideas from the society. And this is why our schools and businesses still remain open today. So for example, every day, our Central Epidemic Command Center holds a press conference, which is live streamed. We work with the journalist community. They answer all the questions from the journalists, and it's all live streamed. And because of this, whenever there's new ideas coming from the civil society, anyone can pick their phone and call 1922 and tell that idea to the CECC. For example, there was one day in April that a young boy that said they don't want to go to school because their schoolmates may laugh at him for wearing a pink medical mask. The very next day, everybody in the CECC press conference started wearing pink medical mask and making sure that everybody learns about gender mainstreaming, which is, again, a social innovation. So this kind of fast response builds trust between the government and the civil society. Another focus is fairness. For example, when we ramped up the facial mask production, making sure that everybody can use their national health insurance card to collect masks from nearby pharmacies, fairness is the guiding principle. So not only do we publish the stock levels of all the pharmacies, but we actually publish it every 3 minutes. And that is why GovZero and many community contributors built more than 130 tools that enables people who prefer viewing maps, or people with blindness who prefer to hear from voice assistants, as well as people who are using the chatbot, like the Line platform, which is very popular and so on, can get the same inclusive access to the information about which pharmacists near them still have the mask. And because Taiwan has more than 99.9% of health coverage, people who show any symptom will then be able to take medical mask, go to a local clinic, knowing that they will get treated fairly and without incurring any financial burden. And this also enabled people who make dashboards that lets people see that our supply is indeed growing, that we now can collect, if you're an adult, 9 facial masks every 2 weeks, or 10 if you are a child. And it shows us where in Taiwan do we have a oversupply or undersupply, and we change the pharmacies based on the real feedback of the pharmacist, so that their received supplies as well as the ordering system is also co-created with the whole of society. So based on the analysis, as you can see our premier smiling happily here, that is because we started working with convenience stores. So you can take the same NHI card to go there and collect your mask anytime, 24 hours a day, because there's many people working in municipality that have a longer working hour than pharmacists. And so before, when we only rationed through pharmacists, they could miss the mask collection simply because they work too late in the day. And so we ensure fairness of all kinds. And finally, I would like to stress that because it's a stressful time, people feel anxious. There's a lot of panic buying, a lot of conspiracy theories. In Taiwan, our counter-disinformation strategy is based on the idea of humor over rumor. So when there is a panic buying of tissue papers, there was a rumor that says it's the same material as facial mask. And there was a panic buying. The same premier, smiling in the previous slide, now shows his bottom and says in a very large print that we only have 1 pair of buttock each. So meaning that we don't need to panic buy tissue papers. And then it shows a very clear table saying that facial masks are produced using Taiwanese materials and the tissue paper are produced using South American materials. And this went absolutely viral. And because of that, the panic buying of tissue paper is died down within a day or two. And finally, we found out the person who spread the rumor at the first place was the tissue paper reseller. And this is not just a single shot point in the social media. Every single CECC daily press conference gets translated by the Ministry of Health and Welfare spokesdog, or 总裁, the dog CEO, that translates social distancing, hand sanitation rules, remembering to pay your pre-orders and so on, all into very cute dog memes. And because these goes viral, we make sure that our humor, our factual humor, spreads faster than rumor. And this is how we make sure that Taiwanese people still feel calm and collected even during the pandemic. So I only have 5 minutes, so this is all I can contribute within 5 minutes, but please feel free to read more in taiwancanhelp.us. Thank you for listening.
All right. Hopefully you enjoyed that video. We're very grateful that we had the opportunity to get that video address. We are now going to have each of the panelists give a short statement, and we're going to start out with Dr. Balkan Devlin. Dr. Devlin.
Hi, thanks for having me, and thanks for MLI for organizing here. Thanks, Sean. And that was a great video. It's very informative. I think everybody will get it a lot. I'll get to the point right away about sort of a brief overview of the situation in Denmark and how Denmark responded to the COVID-19 issue. One of the things that Denmark did is took very early steps in restrictive measures. once it became that this is a pandemic and it would affect. So very early measures to control the spread of COVID-19, as well as support businesses and employees. And this was done in a very broad-based manner. So when the Prime Minister Fredrickson went up, for example, to announce the measures related with the business and employees, this is negotiated with the labor unions and the business associations and industrial sort of associations, and they went to the in front of the press together, and the other measures are negotiated and prepared with all major political parties in the parliament. So it was a consultative process. It was a fast process. And it had the broad support. In terms of the content, they're very similar to the ones that are being done in Canada. Certain wage subsidies, loans and supports and grants to the businesses. Denmark act very quickly in terms of asking state employees and others to work from home, close schools and other places and churches and whatnot. And that really helped flattening the curve in Denmark. I can give you the numbers today very briefly where we are standing in Denmark right now. As of today, Denmark tested about 125,000 people. The population of Denmark is about 5.6 million. There are about 8,000 confirmed cases, a little over 8,000. About 5,500 of them are recovered, and the number of fatalities are about 400. The capacity in Danish hospitals and ICUs are still fine. They're not overwhelmed, and the control is out there. One sort of really important thing I really sort of want to highlight in the Danish response is the government's response, although started having some criticism with regards to the opening phase and the planning of the opening phase, is that it was very broad-based, and it really included civil society actors, labor unions, businesses, universities, as well as all major political parties in developing these plans, and they were clearly communicated to the public. The Danish state maintained a regularly updated website, which is also available in English and not only in Danish. That's daily updated. The Serum Institute, State Health Institute, provides reports and that are the basis of the government's decisions on when to open and how to open. And a gradual opening started, and it's a very, very gradual one after Easter break. Only few number of classes, younger students allowed to go. A few businesses such as hairdressers and others that only see a few customers at a time are allowed to operate. The public employees are still working from home. Most people are encouraged to work from home. There are restrictions in terms of how many people can be in the transport, for example. And these measures are again being discussed and in a way negotiated with the political parties in the parliament. So there is a continuous sort of oversight of the government action, and I would say the transparency is what is being done and why they are being done is key to Denmark's success so far.
That was brilliant, Devlin. I would love you, Vulcan, to keep talking for half an hour, but unfortunately we have to keep moving on. That was fantastic. I have about 10 questions I wrote down. Anyways, we better move on to Dr. Tina Park, and if you're ready to go, take it away.
Good morning, everyone. Thanks so much for tuning in online and joining the conversation. I'd like to begin by also thanking the Macdonald-Laurier Institute for this very kind invitation to speak to you this morning. As we are collectively struggling to deal with the COVID-19 situation, South Korea has emerged as a success story for flattening the curve with no travel bans, lockdowns, or any draconian measures that might damage the domestic economy. I'd like to spend the next few minutes to discuss the key lessons from South Korea's handling of COVID-19 as we look ahead to our eventual recovery in Canada. As of now, South Korea has one of the lowest COVID-19 mortality rates in the world. In the past week, there's been only about 10 new cases of patients who tested positive for coronavirus and 0 new deaths related to COVID-19 since March 16. There's also a sense of normalcy slowly returning to South Korea as we speak. Since its first confirmed case of coronavirus in late January, South Korea adopted a very coordinated and centralized strategy based on aggressive testing, with about 20,000 people being tested every day, which was far ahead of other governments. And I would say the takeaway points are as follows. The first and perhaps most important aspect of South Korea's response was the highly coordinated, very prompt and decisive response from the government. The Prime Minister's office created a national strategy with a centralized task force for all levels of governments, authorities, and regional offices. And when one region in Korea, particularly Daegu, ran out of hospital beds and doctors, others from different hospitals and medical associations stepped up to ensure that there was movement of healthcare supplies as well as doctors. And that was very important to have a coordinated strategy. Second, there was also a policy of absolute transparency and data sharing. There were regular updates for Korean citizens from the Korean Center for Disease Control and Prevention, at least 2 press briefings and regular data updates, which were available from mobile phones for the citizens. There were also updates based on new cases. So if there was a confirmed patient who passed by a grocery store in a neighborhood, people in that area would be notified and would be informed when the full disinfection had taken place. Third, Korea adopted what's called the triple T policy: test, trace, and treat. South Korea had about 95 testing centers set up in about 2 weeks' time to increase its testing capacity, and the labs were running 24/7 to provide test results as soon as possible. For instance, South Korea has had about 240 deaths so far from COVID-19, compared to over 25,000 deaths in Italy during the same period. And there was a very strong correlation between aggressive testing and low mortality rate from COVID-19. South Korea also used various apps, so coronavirus mapping apps, some of which were developed by high school students, others developed by the government or private companies, which were all available for free, and it would map cases as they broke out, and everybody could access it for free. And to do this mapping, South Korean government used satellite technology and various other tools like credit card history, mobile records, which were all provided by the confirmed patients to trace them and notify those who had contact with the confirmed patients so that they could also be isolated and treated if necessary. So using technology for diagnosis and isolation really accelerates the containment efforts. Fourth, there's a very important element of public-private partnership. It was actually biotech companies in South Korea who voluntarily developed testing kits when the outbreak began in Wuhan, China. And there was a lot of heavy lifting done by private companies to disseminate testing kits and run the testing labs like drive-through centers. So it's absolutely critical at this juncture for governments to actively collaborate with the private sector. Fifth, there's a longer term investment needed in healthcare infrastructure. South Korea was much more prepared than others because of the experience with Middle Eastern respiratory syndrome, MERS, outbreak in 2015. And the government started investing more in ventilators, special care units, and masks, etc. But this is also the same country where you could literally walk into hospital for an MRI scan and get it done in an hour and come out with the results. So there was already a very functioning healthcare system in South Korea, and a lot of it has to be done on a longer term basis. Lastly, we have to also look at collective solidarity and public hygiene, and a lot of voluntary efforts undertaken by South Koreans. Everybody wears masks in South Korea, and they practice social distancing as of late January, and working from home or studying online, and relying on deliveries as opposed to going out. have all been happening since late January. And while South Korea and Taiwan are competitive free market economies, there's a deeper sense of common and collective interest that is very deep and compelling among the public. There was no panic buying in Korea, for instance, because it is a country where anything and everything can be ordered online from the mobile phone and delivered within 24 hours. So what could we adopt in Canada? First is the widespread testing. Private firms like South Korea are exporting testing kits to the US, the UAE, etc. We know that Canada has a shortage of testing kits, and aggressive widespread testing is absolutely critical so that we can isolate and treat confirmed patients as efficiently as possible. Canada has a free trade agreement with South Korea, and we had a history of very active bilateral trade. A lot of testing centers can be set up very quickly, such as drive-through centers or phone booth testing centers, etc. And now is the time to take advantage of this long-standing relationship and do what it takes to test our most vulnerable population. Second, we have a great need of collecting data in Canada. The lack of data in Canada and different policy measures between provinces will eventually delay our ability to bounce back. We, for instance, have no data on the ethnic backgrounds of patients tested positive in Canada, or the age of those who are being tested, or how this situation is affecting people in different economic circumstances. And there is a massive data gap as well when it comes to Indigenous population. So in addition to addressing gaps between provinces, we just need to ensure that there's transparency in data sharing so that public feels very confident about what's happening, and we will not be able to come up with the proper exit strategy from COVID-19 without real data so that our experts could analyze them and plan for the future. Lastly, we also need to ensure that we use technology to our advantage. South Korea benefited enormously from contact tracing and developed various apps to track the spread of virus. And this kind of embracing technology is absolutely critical because I think technology holds the key to resolving a lot of stresses arising from COVID-19 situation. And I know a lot of people are concerned about giving away personal data to companies and governments. And I am not a fan of data sharing to the extreme. But if sharing my phone record could help save lives, I will absolutely do it with no hesitation. And I think there's a sense of expectation in South Korea when you share data that it would be used for public good. And that's a cultural change and a collective mindset when it comes to using technology in crisis. So I will leave it at that, and I will look forward to your questions. Thank you.
Oh, that was just fantastic. Thank you so much. And again, I wish we had, we did a lot of work trying to cram this all into 1 hour. This should be 3 or 4 hours, but anyways, awesome. Really, really appreciate that, Dr. Park. So now we're going to go to Professor Chang and take it away.
Hi, I'd like to thank the institution for having me join this very important cross-continent, right? We have Denmark and Canada and Korea. I myself is a medical doctor, professor at medical school, and now I'm ombudsman. And being an ombudsman, I'm watching how the government is doing regarding this emerging infectious disease, COVID-19, since the first day. Well, like the Minister Audrey Tang already mentioned, but I will not repeat whatever he has mentioned. I think the strength of our situation that we only have just a little bit more than 400 confirmed cases. We have almost the same population number like Canada, and we have much more condensed population density, almost the topmost one in the world. And you know, the population density is the highest risk factors of this virus. So we only got 2.5% of the confirmed cases compared with Canada. How could that be? I think that we start early. We were having the alert December 31st, the last day of last year, and I'm already on this alert for 114 days. We haven't get relief, but with this high alertness really helping us start with the first beginning. Some people say that if you succeed in the beginning, you already 50% down. I think that tell a little bit about how Taiwan was really comfort at this moment. We have school open, universities open. Well, theater has been asked to reduce. Karaoke and pub just been asked to take a break for 2 weeks since last week. So, you know, we have very relaxed if you compare with other countries. Well, we have only 400 cases confirmed. And another reason is that 10% of this case is really from indigenous, means that they are coming from community transmission. The other 90%, you see, we have 90% of cases coming from outside, and only 10% means the transmission was possible, very little chance. And how could that be? You have many people coming out, 90% coming, you get them, and you contact tracing, like the Korea will say, we find any cases of the confirmed, and we trace back who already been contact with them in the last 2 weeks, and find out all the people. So we screening 57,000 cases, not from the community. Not someone said, well, I feel fever, they will be screened by a doctor, but these 57,000 cases really having a cross contact with some individual, right? They already been confirmed. So we have a much smaller scale, means a more concentrated focus on high risk population, that we got 57,000 tested cases, and that we got 400 confirmed cases. So how did that happen? Is that we started alert. I think we were the first one after beyond Wuhan to start this alert. December 1st, our CDC reading some of the social media, and they say, well, this might be true. And I remember in late December, even around Christmas, I read some newspaper, and they say that in China, they have some unknown reason of pneumonia, and that recall what SARS already told us. But we didn't saw, well, how could that be SARS coming back? It's already forgotten decades ago. But there was a rumor in the newspaper said that there may be some unknown reason of the pneumonia. Well, you don't report pneumonia. International media, right? You don't report pneumonia. Pneumonia is a very prevalent in the winter times, but they said unknown reason means something unusual. It's already around Christmas, and December 31st, really it's coming some message from China to the local people. And so our CDC pulled the alarm, like you saw a smoke, and you pull the alarm, ambulance, and you say December 1st, and that Taiwan CDC already have a press release openly said that this unknown cause of the pneumonia might be possible. And January, 2 days later, they already stopped all the flight direct from Wuhan to Taiwan. You know, we have 1,000 people who come from Wuhan because there are a few flight airline they're going to. So in 2 days, they broke Wuhan flight already. But even until today, we still have a direct flight from Beijing, Shanghai, and Guangdong to Taiwan. Today, still open. So we have the epidemic, really good control of the epidemic is really going on. You know, unfortunately, we have 1,000 of Taiwanese, their business, they are in Wuhan, they cannot go home since then because the block of the flight. And I think we are the first one to say, well, we have to stop the flight. With very little information, unknown cause of the pneumonia. Well, I see that is very aggressive, but that aggressiveness really helpful. And now, so contact tracing is very important. We trace all the individual, and we have a very good epidemic control center since episode of the SARS. We have a new team of the physician and health profession. They are really good in calling the individual that and interview. where have you gone, and what kind of city you travel to, and that really helpful. And I don't think the contact tracing can work in later stage. In Canada, in USA, if you would like to, you do it very early in the beginning, because if you have 100,000 people, you have the contact tracing, almost you already lower down your barrier. They can go to everywhere. You cannot stop everyone. So that's the first thing I would mention. The second one is social distancing. Well, you know, we are very crowded, narrow, densely populated city, metropolitan. In Taiwan, we don't have a rural area, I would say. It's really metropolitan everywhere. And how can we do that? We have a subway, we have massive travel. The mask really help. The mask, putting the mask, because air pollution issues, PM 2.5, we already have people putting in a mask in a daily basis. They're riding scooters, and they are in a metropolitan. There are people wearing different kind of mask already, even before the episode. And so it's much easier for us to raise up. Well, we don't know who is going to really. There was a discuss about how far this virus can go from one individual to the other. You know, there was a debate several weeks. Are they air jobs? Are they really coughing or sneezing? And so we are very early, even without the alarm, people start putting the mask. Okay. The second issue is that how many masks we have to offer. And so the government is really smart to say that, well, we have to produce as many masks as possible for everyone. You know, you cannot wear a mask for 1 month, because if you use daily, you have to 1 or 2 masks a week, right? So we start to call up. That's the reason Minister Tan said that we call up a national team to produce this face mask. And actually now after this, I have using my insurance card, and I can go to any easy shops, convenience shop, and I get 10 masks, paying actually is half Canadian dollar, right? So I can have this for 2 weeks. So it means that well, many people don't use it, because if you stay at home, you don't go to school, you don't need so many. So we can able to export or send some more masks to other country, because we call up the team and we produce our mask. Before, we don't have so many mask production capacity. Many of these factories, because mask is very low price, it's not very high profit. So many companies were setting up factory in China. And we heard that China started to call up block exporting of the mask since in January. So in that case, we will not have the mask. So with mask is kind of a security for people to go outside. Well, certainly there are arguments about how good is the mask. But actually, I visited a mask production company. There are 3 layers. There are 3 layers of this mask, and the middle layer is a core layer, is for non-melting woven style, and that was a patent of some brilliant scientists in the state many years ago. So they can protect N90. It really go into N95, and they can trap the virus. So I see. Well, they are different kind of mask, but this medical scale mask is for general public, not N95. N95 is only secure for the healthcare providers, but for the public, they use lower grade of mask, and this is really, I would say, people say that, well, mask is really not in the culture. Yeah, maybe luckily we have that mask in our culture long before. And the second is that it's very low price, and it keep alarm, it protect us, and it protect the others, you know, protect the family member in the community. So I think the mask is one of the very important low investment, because you don't have a vaccine, we don't have a testing for everyone. Like USA, they're going to test everyone. In Germany or Korea, they want to test everyone, but it's very expensive, and it's going to load the medical facility very much capacity for that. So I think we are a little bit conservative, right? We don't want many suspected cases going to hospital and clinic. And I think the mask is really keeping this safety about the social distance. Certainly, we start to reduce number of the mass gathering in early March because we have a religious activity very active in March, and the government already said in February they say, if you, they was able to persuade a religious leader not to go to big gathering. If we didn't do that, we can see we will be look like Italy. You know, people go to carnival, go to football games. So that reduce big risk of the massive communication and transmission in the community. So I would say we practice several different ways, but some of the particular action by the government. And last thing is that because SARS, we was really learning a lot. And in this epidemic, urgent one, you need a very strong leaders that they can say, they can really go to all the resources. And people follow that, because if you ask people to stay at home, they cannot do something. You need to convince them. This is good for them, right? We are helping people. If you don't follow that orders, you put your family, your friend, your classmate at risk. So there was a big public trust from this command center.
That was fantastic. Thank you so much, Professor Chang. I really liked what you said about masks. Gosh, I'm going to share this video afterwards with all my friends and colleagues in the medical community, and I'm sure we'll get into some good debates about that. So if possible now, we'd like to move into some of our questions. We have 5 moderated questions and 4 questions confirmed that we had dozens and dozens of questions. I think I'm going to limit some of the moderated questions just so that we get through some of the submitted questions. Our time limit is the hour mark, so we'll see how it goes. I'm pretty confident we won't get through all 9 of them, but the first question is to Dr. Devlin, and so Vulcan, if you're on deck here. And the first question is, how have political positions impacted approaches, if at all? Do classical liberal governments manage outbreaks better, or do centralized command economies tend to outperform? How do we reconcile lockdown requirements and testing and tracing programs with human rights? So over to you, Dr. Devlin.
Well, as you said, we probably need a couple of hours to be able to discuss some of them, but I'll try to be brief and try to get to the point. First, with regards to the liberal democracies versus more authoritarian regimes, first, there is no evidence that those regimes do a better job, in the sense that we really have to realize that from the very beginning, including China, but other places, the numbers that are coming out from those places do not necessarily reflect the actual events. These regimes, these authoritarian regimes, their functioning tend to rely on hiding, lying, dissimulation, etc. And there's a lot of incentive to look strong and to show that things are just fine. There's nothing wrong going on. But this is true for the local officials, but also for national officials as well. So actually, there is no clear evidence that neither in the early stages of what we are going through right now, nor for the future, there is evidence of authoritarian regimes doing a better job. And one of the primary reasons for why actually democracies are better equipped to deal with is the issue of trust, as 2 of the previous speakers both highlighted, and I think is essential both in the case of both Taiwan and South Korea, as well as in Denmark. The high level of trust that is required between the public and the authorities, and that is, although we do have sort of trust with regards to the governments and so forth, in some of the democracies we do have some issues. That is much more important, that you actually do trust, and for the long-term dealing with the consequences of this pandemic, and authoritarian regimes don't have that. They do. There's governing is not relied on high levels of trust to the authorities. It relies on oppression, it relies on control, it relies on surveillance. And we know from all sorts of studies from political science and other places in sociology and history and so on and so forth, that under those regimes where your survival depends on the way you look like you're obeying the rule, but you're not, there will be a lot of problems going forward. And as Merkel pointed out in a speech a couple of days ago, that we are very much in the beginning of this. So this is the suggestion that the authoritarian regimes sort of get a handle of this very well and then they deal with it is, I think, is the false siren song of this. And as we go forward, there will be a time that will come up, and it's coming up, of tough decisions that needs to be made. And democracies that have high levels of trust between the authorities and the public are better suited to make those decisions and implement them, and then have others sort of coalesce around that. This is a typical collective action issue. And we need that high level of trust to function. So no, I don't think more authoritarian forms of government are effective, neither at the beginning stages of such a pandemic, nor in the long-term consequences of how to deal with both the economic and human costs of that. Now, the issue of tracing, testing, isolation, and how that sort of can be squared with individual rights and liberties. Maybe four things very quickly. One is the issue of testing. We need to sort of realize that testing is extremely important, yes, but it is no panacea. It's nothing. It's not the magic bullet. There are several reasons for it. One, both of the speakers actually highlighted that. I mean, it's expensive. It requires sort of a very coordinated effort. And if you have large population or a population that is actually distributed over a large geography, you do require great human resources as well to go and do the testing. But also the tests themselves could have issues in terms of accuracy, even if you do end up getting very, very accurate testing, both in terms of diagnosis testing, but also serum tests or immunity tests. There is the issue of we don't know the true rate of infection in the population, and without really sort of getting into the Bayesian probability, even if you have a test that gives you high levels of true positives and true negatives, what is called sensitivity and specificity, say 99% of it. If you don't know the sort of actual prevalence at the population level, you will get a lot of false negatives, for example, even if you have a 99% specificity. So you will think that the person has positive and thus need to be taken care of or isolated or can recover, while actually that person didn't have the virus, right? These problems get less when the virus is more widespread in the population, say 30, 40, 50% of the population. But if we are not at that stage and we don't know what is the actual distribution in the population, the testing would not give you the full picture, and it would be important, but it's important to be realistic about the possibility, and it requires a lot of human resources as well to go out and do these testings regularly. In terms of tracing and surveillance and observing who has the thing, I think there are three issues here, and I agree that technology is key to be able to get a handle on this, and high trust societies do a better job. But I think we need to keep in three things in mind, and to sort of ease people's fears about this. One is the importance of oversight, right? Such a data collection through apps and tracing and data processing need to be overseen by multiple actors, including. So this should not be only a government project. This should include oversight from the parliament. This should include oversight from civil society. It should be transparent. In other words, that the public need to know that this is used for a very specific purpose, and not abuse. And oversight, parliamentary oversight, and oversight by civil society actors are, I think, crucial. And it is easier to do in certain societies where there is a higher level of trust than others.
Yeah. So Devlin, I apologize. We probably asked you such a huge question that, and you're giving a fantastic answer. I feel terrible jumping in. But is it okay if I jump in? I just want to ask the other two a couple. What you're saying is fantastic, and clearly we've learned that we didn't book long enough for this, and I feel terrible jumping in. But loved your first part, especially where you said, we don't know how this is going to turn out, and certainly we're not even sure we can trust the data. I wanted to ask Professor Chang a question. So Dr. Chang, if you're on deck here now, and you mentioned about protective gear, and the moderated question we had for you is, how should we best deploy limited testing capacity and protective gear? But I want you to focus on the protective gear, because Dr. Devlin's actually already talked about the testing part and the pretest probability. So if you could focus on the masks, Professor Chang, how do we acquire a more increased supply given unreliable global supply chains? So if you have any thoughts on that.
Yeah, well, in terms of the experience in Taiwan, I mean, in the public health, we have to know who are adding the highest risk of the perform their job. Is the public or someone in the hospital or the quarantine epidemic infectious disease profession? We have to give the protective gear to those going on board of the airplane when they are receiving some of the passenger coming from the so-called epidemic area. That's the first one. The second one, you have to protect the people in the hospital. I would say the hospital care person should be most protected. If they without gear, because
how do we get more masks?
Well,
how do we get more masks?
Well, that's very important. We have to learn that, because in the before, people saw this mask is cheap, is low profit, and they outsource all this manufacture to developing country or some manufacturing capacity, and then you don't have that, and you need to have a stock. Actually, our Taiwan CDC stock a few millions of the medical mask in their storage constantly without change since 13 or 14 years ago. I was amazed that I have to keep this medical mask for a long time, and they replace some of them constantly. And people say, well, you are wasting the tax money to buy something without useful, but now they pay back in 1 year. It's all the investments really prepare for that. But actually, some of the leaders, Obama also said that a few years we're going to have that. Bill Gates also mentioned that we don't know when this virus really come, but now it's really coming. And so I was talking with some people. They have been keeping all these resources in stock for decades without being used. And they start to question, should we keep it? But now people know this is a really important investment by the government to keep enough of protective gear, and also to produce some of the gear for themselves. This is, you cannot borrow from your neighbors extinguishers when the house is in fire. So really, every country, every community should have the protective gears at home, at hand, without borrowing, because there was a time factor in this area.
Yeah, brilliant answer. Thank you so much. So, Dr. Park, we want to ask you a question now too. Given Canada's struggles to make even essential workplaces safe, such as the meat processing plant in Alberta that had to be shut down, how can we make other sectors safe as they're reopened? So manufacturing, schools, restaurants, that sort of thing. Dr. Park, do you have any thoughts on that?
Thank you, Sean. First of all, we've seen that through the COVID-19 crisis, there's been a fantastic acceleration of digital transformation in all sectors. And that's actually quite positive. And as we move forward towards the recovery phase and designing an exit strategy from coronavirus situation, we will really have to integrate technology to whatever we end up doing with reopening sectors. And there's absolutely no clear strategy at the moment that is national in nature. What we really need is for the Canadian government to get into coordinating with different provinces and ensuring that there's a delicate balance between the stimulus and restraint, so that we could restore the public confidence and also ensure the resilience of supply chain industries. And we will also see that it will have to be a gradual opening, and different sectors will open up differently and recover at a different pace. I think it's very important to remember that consistency is very important, and different provinces in Canada have come up with different plans. I know Saskatchewan and Quebec, for instance, are very much interested in opening up again in May, but I think it has to be a national strategy, and we have to ensure that along with that risk management, different sectors continue to invest in using technology whenever they can.
Yeah, brilliant. Thank you so much. We're going to jump ahead actually to some of the questions from the audience. Fantastic responses, by the way. And I know you're cutting yourselves off short. I feel terrible about that. One of the questions we get actually is from Mr. John Daly of Global News. And I think, Professor Chang, you could probably comment on this, and as well, Dr. Devlin, with your Bayesian pretest probability and comments, I think would come in here as well. But this is the question from John Daly. He says, with the concentrated outbreaks of COVID-19 at meat and poultry packing plants, as well as long-term care centers, and the very high death rates there, has the time not come for prophylactic testing? So he goes on to say, I'm told that the test with asymptomatic subjects has a 30% false negative rate, and Vulcan, you were talking about this, but does that not still mean that we're catching 7 out of 10 COVID-19 cases early and possibly saving lives? And how expensive is this test anyways? So maybe I'll get Professor Chang to comment on this just briefly, and then also Dr. Devlin, if you could be on deck to add to that as well, given some of the comments you made earlier. So Professor Chang, why don't we just test everybody?
Well, I think it's a dilemma, right? Because the testing so far, PCR is the best one, but the sampling of this is very painful and is expensive for the PCR, and it's time consuming. Then we need to have some better test, antibody testing. But there's antibody testing is just available, in some of the early one just been approved by FDA. We have a few really trying to go to the market, but how can this antibody testing reliable? And also there was a time frame. One individual been in contact with the virus, and in the first few days they start to really got the virus really replication, and then it's a different time of individual. But usually when you retrospective ask the individual which confirmed, they didn't know when did they got a contact, right? Until really who was really disseminating the virus to them. So that's really difficult. So far there's no comprehensive antibody testing. Because I'm reading this every day from the literature. There's no For example, if you contact with someone, for example, someone visit a patient, and in a few days he should test the antibody IgG or the others. It's not clear yet. Availability of the different kind of antibodies are limited. So better is use the PCR and antibody and following up the time. But we cannot do that to many people. That's the reason. Well,
thank you.
The money is not the most difficult. Is that the scientific we still do not have adequate information on.
Yeah, brilliant. And Vulcan, do you have anything to add to that, just very briefly about the? testing
Very
everyone?
briefly, Dr. Chang covered, the salient points. What I would actually add that we need to understand the unpleasant fact that there is no magical bullet in terms of testing because of technological problems, because of the scientific uncertainty surrounding it, including the sort of the immunity and antibody responses. It takes time to develop those antibodies. It can be not sufficient in quantities to be recognized. It could be the antibodies that are developed to a prior coronavirus, not to this one, and can actually confound the results. With the prevalence in the greater public is still low, so our rates of false positives, false negatives would be different, and so on and so forth. So there are a lot of uncertainties surrounding technological and scientific and probabilistic uncertainties surrounding the testing issue, and thus, it is an extremely important component, but it is not a magic bullet. I think that's the message we need to remember.
Brilliant, brilliant. So you've proved me wrong. I've been saying test everybody, and both of you guys said don't do that yet. So I'm learning a lot, and especially on that point.
Well,
Dr. Park, can you be on deck for this question?
No, I mean, if you want to do test, they got to have a very good strategy, and you have to review that, improve it. It's just not one shot deal. You have to continue doing it. And now everyone is learning from everyone else, right? We're learning from each other.
Brilliant. Yeah. No, thank you. That's great advice. So Dr. Park, if I could have you on deck for this one, and hopefully we can squeeze in one last question. This is from Preston Manning, and Mr. Manning asks, and this actually relates to some of the things Dr. Devlin mentioned earlier as well about trust, but Mr. Manning asks, is it not true that the stronger and more established the relationship between the scientific community and the political community, the better equipped the political community will be to handle crises like COVID-19? Was not part of Taiwan's success due to the fact that its vice president, a political position, is occupied by a distinguished scientist, an epidemiologist? What therefore can be done to reduce the gap between the scientific and political communities in Canada? So to you, Dr. Park, in 45 seconds or less.
Thank you, Mr. Manning, for this excellent question. Yes, I agree with you that I'm in full support of reducing the gap between the political and science communities in Canada. And in fact, we have seen that in the past, when the SARS outbreak took place in Canada, Minister Carolyn Bennett, who was appointed as Minister for State of Public Health, worked very closely with Dr. David Naylor to come up with a strategy. And I know that the Canadian government just announced $1 billion to fund more research, and Dr. Naylor will be on that task force again. So we have seen some very constructive approaches also being undertaken in Canada. And we know that in the case of Germany as well, Angela Merkel's science background certainly helped, but I don't think it's just one leader who makes a difference in dealing with COVID-19. I think it's a national effort at all levels of government. And yes, we do need to make sure that we dedicate more resources towards the STEM fields, and that we encourage more people of different backgrounds to engage in science and research. And having that culture for innovation and encouraging things like startups has been very successful in Israel or South Korea, where you really depend on the strength of the research community to serve as the driver for innovation. And I think a lot more could be done in Canada, and I look forward to seeing some of the positive outcomes from our very strong research communities in Canada.
Yeah, brilliant. Well done. Well done. I think maybe 46 seconds, but that was fantastic. That's awesome. So we're going to try to have a summary statement from all of you. Literally, we have 2.5 minutes left, and we're going to go in reverse order. So if you had one thing to tell Canada, to tell the policymakers in Canada, we're going to go Dr. Chang, then Dr. Park, and then Dr. Devlin. So if you could tell us one pearl of advice that we haven't heard yet, or that you want to emphasize, Dr. Chang.
Well, I think the health policies should be in all the government policies, and this cannot be ignored, because investment in health, usually people say that your budget is wasting for disease, but actually health budget is most most important investment by any government, particularly prophylactic preventive measures, vaccination, which is most cost effective. And usually many politicians and the government ignore the significant contribution of the health policies and investment.
Brilliant. Brilliant. Thank you, Dr. Park.
I think I would just like to touch upon a question we didn't end up addressing, which is the issue of seniors being affected by this crisis. And I would just like to stress that we need a serious cultural change and paradigm change in how we view seniors and care for older Canadians who have sacrificed so much to build Canada as we know it today. And yet we're failing them because these hospitals and nursing homes simply lack staff and supplies. And it takes no rocket science to add more hospital beds and give them separate rooms and make sure that the care workers who work at the front lines are compensated well and fed well. We know that some of the seniors who arrived in emergency centers in Quebec were suffering from malnutrition and dehydration, and that's absolutely appalling. So I would say that moving forward, Canada needs an exit strategy, and that has to be a national one, and because we are seeing discrepancies between provinces. And ultimately, we'll have to integrate digital technology for diagnostics and antiviral treatment. Until we develop a vaccine, we will not see a return to normal life as we knew it before. And we're looking, for instance, just in Ontario, over 600 residential homes and some 2,000 senior homes in Quebec and other provinces. And a lot of them, actually, I think over 90% of them are understaffed and require better support. And we're looking at very vulnerable populations who are in need of better air circulation, better facilities. And we also have to keep in mind our multicultural composition and our Indigenous population, as well as the special needs of LGBT community, where they just have different needs and different pre-existing conditions. And at this point, I think Canada really needs to call upon its resources and ensure that we do some serious long-term thinking about how we will deal with aging population, because by 2030, 1/4 of Canadian population will be over the age of 60. And at this point, we simply do not have a strategy to deal with our shortages as we know it. So I hope we will get through it. And when we get through it, that we would spend some time thinking about long-term plans.
Thank you so much. Devlin, Dr. Devlin, you have the last word, and then I'll close things off.
Okay, thank you. I'll be brief. I think the Canadian authorities should keep in mind that transparency is a key component in ensuring trust and dealing with this. And we should also keep in mind that fundamentally the accountability and responsibility lay with our elected representatives. That centering technocratic and scientific community in front could serve to blur that fundamental responsibility, because it is going to be tough decisions are not going to be coming out of from a very clear scientific way. Their role is important. It has to be informed by scientific advice, but it is advice, and we will turn to and we will hold responsible our elected representatives about the policies, and that's why we elect them. So we should keep that in mind as we go forward. And the last thing is that the uncertainty laying in front of us is significant, and we should disabuse ourselves that there will be a clean Hail Mary solution that is coming up, and accept and be ready to make difficult decisions in the coming months.
Brilliant. Thank you all. I want to, thank you all again. I've really enjoyed. I feel rushed. I wish I could have spent more time with each of you panelists. Thank you to those of you who submitted questions. Thank you to the staff and all the other fellows. I mean, people watching here think that it's just us doing this. There's a crowd of people who've worked tirelessly on getting this done, and beyond that, there's literally an army of supporters out there that have been supporting the Macdonald-Laurier Institute, and a huge shout out to them as well. Stay safe, be well, and please share this video with others, and let us know what we can do better next time. Check out the Macdonald-Laurier Institute website, sign up for their public policy magazine. Thank you so much for watching, and thank you again to the panelists. I hope you have a great day. Bye.
Thank you. Best wishes. Thank you.